Hello and welcome to the first and last episode of this podcast. Today we're going to be talking about the tensions between the professional sector and the alternative healing in the Western society. What are the pros and cons for each, and can they operate together or should they remain separate institutions? I feel like to have a really ample discussion about this, I feel like we should bring in an Eastern country, specifically Turkey, to really compare. I'd like to introduce my friend, Hande.
Hello.
Let's just talk about a little bit about the pros and cons for the professional sector. So, I feel like Western medicine, like a benefit is that it is pretty evidence-based. Everything is performed and backed by statistical evidence.
Mm-hmm.
The numbers really matter. So, I'll give a recent example is that COVID vaccines, and vaccines in general have been through rigorous testing, and it's prevented many diseases like mumps and measles, and the COVID vaccine has significantly reduced numbers, right?
Mm-hmm. I think the professional sector of Western medicine is effective. It's backed by science and data, which is whatever is FDA approved is what they go for. But I also think that having a closed mind like that and not trying other versions of medicine is seriously not helping the countries in the West here to grow medicinally.
Yeah, I agree. I mean, one con for the professional sector is that there's a replication crisis. It's difficult to replicate research that's already been done, which kind of makes you question, the discoveries that science has actually made.
Mm-hmm.
I think the unfortunate thing is also, as you mentioned, that, the professional sector holds scientific authority.
Mm-hmm.
The racist beliefs that they've, had, still seep their way into institutional medicine. Half of medical trainees believe that Black people have thicker skin and less sensitive nerve endings.
It's true.
I think also another con is that, there's over-medicalization of just simple human activity. For example, when I took my death and dying class, a big discussion was that the West has medicalized death. It used to be something that was religious and a familial experience, and it's now shifted into the medical institution,
Mm-hmm.
Yeah, it's become kind of like a detachment. I feel like people are afraid of death, too. But it never used to be that way, so I feel like maybe shifting it back would be a great focus, too.
Yeah.
Because I feel like also in Islamic culture, right, death is it's a very personal thing. There's somebody specific who washes the body.
Yeah.
It's a very, close experience that you have with everybody.
Yeah, that's very true. That's a common practice there. My mom actually worked as someone like that who cleaned bodies. And it wasn't for any kind of monetary gain either. It was voluntary work. Just because somebody had to do it.
Mm-hmm.
You get a sort of spiritual gratification out of doing something like that, and it really is work that needs to be done, so it's normal there.
Yeah,
it's actually a humbling experience. People would be honored to do something like that.
Yeah, I think there is a detachment there. We've shifted it away from everybody. We pay people to do these things now. We pay a funeral service.
Yeah, that's true.
The more extravagant it is, obviously,
it's
right?
kind of bleak though.
It is. I think the detachment is very severe. There's nothing there.
Death should not be a business, if you ask myself.
Yeah. I think also, we over-medicalize children too. We kind of medicalize, like I said, normal human stuff.
Mm-hmm.
Oppositional defiance disorder was in the DSM at one point, which was basically a rowdy kid, a kid who likes getting into trouble and all that. You're looking at normal human activity through a medical lens, which is so harmful in the long run, which I feel like we've done so much now.
Yeah.
Even self-diagnosing among like teenagers.
Oh, that's very popular.
Yeah, like even you can see it now on social media, like TikTok, like you know, oh, my ADHD is acting up. Oh, you know, my OCD is so bad. And it's kind of like we medicalized
depression, anxiety is rampant. It's a personality even.
Yeah, exactly. Yeah. Even though, you know, having like a symptom of, you know, sadness and despair is like totally, completely normal.
Yeah, it's part of the human experience to some degree.
Exactly. But, you know, we look at it through a medical lens, which is now harming like future generations.
Absolutely.
And not to mention, you know, obviously the obvious one, which is like the overprescription of opioids, which is like destroyed certain communities in the West. Yeah. I think the pros of complementary alternative medicine is you're taking into account the spirit, the body, and the mind. You know, you're incorporating the entirety of the person. You're not just treating the symptoms that could be part of the larger problem. You're looking at it, you know, as in the big picture. You know, like for example, the concern with underlying disease. I think the example that we used in lecture was you're not treating just the fatty liver, you're treating the emotions behind making you eat more.
Yeah. Absolutely.
You know? Yeah, and it's interesting to see also that the individual demand in Western culture has caused complementary alternative medicine to be integrated in hospitals. You're starting to see it more because people want it more, not necessarily the medical institution itself. But there's a demand for people who it's just not cutting it for anymore.
Yeah.
Yeah, but I would say a con for this is that I think the obvious one is that you really don't know if any healing is actually taking place for alternative medicine.
It's hard to measure. Really, what you can do, the best way to measure it is by looking at a person and their overall quality of life. You know, are they happy at home? How are they with the rest of their family and friends? What does that look like? And is it related to the medical attention that they're seeking?
That's a great point. But again, like the unfortunate thing is that the professional sector holds a monopoly. You know, they've kind of made people believe that healing, or like who believe in this healing, are being duped. You know, that it's all hoopla.
Yeah.
But you know, it's still inaccessible as an industry. You know, it's worth millions of dollars, and you know, I think in one of my tutorials we talked about how some of these retreats and these therapies are tens of thousands of dollars.
Yeah, not feasible for the average person.
No, not at all. So I feel like in that sense they are taking advantage of a lot of people, you know. Yeah, so in Turkey, they've actually legalized alternative medicine, and they have started training doctors and nurses within hospitals to, you know, take these training certifications and kind of learn these alternative treatments and practices. You know, but I think the one of the cons of that is that the regulation creates inequality. You know, one person brings up in the article that only those who, you know, have the wealth and the ability to pay for that can benefit from those treatments in the hospitals. And, you know, the health ministry wants to regulate these kinds of ancient treatments, but, you know, poor Turkish people are again left in the hands of incompetent people who have little knowledge of alternative medicine.
Yeah. I know a popular form of medicine in Turkey is called cupping, for example, where you take cups with candles in them, put them on one's back with teeny tiny like razor cuts, and what happens effectively is the flame will consume all the oxygen it can between that person's skin and the cup, and when there's nothing left, you've just got the raised skin and all the bad blood taken out of the patient's body. And it is an ancient practice, but the reason why it is practiced to this day is because it's effective. patients they feel lighter after, they feel better afterwards. And I think with Turkey, you can't really talk about the medicinal field or any field really without bringing up their faith, because it is an overwhelmingly Muslim country, which means Islamic medicine has bled into the professional medicine, I guess you can call it. And so, in my experience, for example, as a Turkish person, when I was sick, superfoods such as honey were definitely in my tea growing up. And not only just honey, but other foods like olives that are mentioned in the Quran, or pomegranate, or figs, were a big part of our diet and known as, again, superfoods.
Yeah.
With tremendous healing properties. And I guess before in the past they didn't know what exactly that meant. They would just call it healing properties. But today when we look at the DNA of a fig, we see that there's so much in there that is so good for us.
Yeah.
So, and same with honey.
Yeah, no, it's interesting that you brought up honey, because in Honey, Hadiths, and Health Day, it was speaking to healing in the daily life of Boston Muslims. And I think the basic premise of the article was that honey was, it was mentioned in the Quran, basically. And it did have, according to the Quran, it had healing properties. Yeah, I mean, when we talk about honey, honey was known to heal cuts, heal acne, soothe the throat, and, help the stomach. And it was mentioned in the Hadith, it was mentioned in the Quran, and, the biomedical discourse was that modern medical understandings of the benefits of honey integrate, the teachings of God, and it works alongside medicine. It's kind of woven into the fabric of Islam.
Absolutely. Yeah, I think the mentality with Turks is that, just like the general public, is that everything, all the medicine we have today was made out of our current resources. So by that logic, if you're having just an apple every day even, or just if you're just eating right every day, or doing these like practices directly from the source of what might be healing you to begin with, then in a sense you're getting the most effective treatment that you can. Even if you're not already sick, it's definitely a preemptive measure that is part of the culture, just to have green tea every day even. And we see today that green tea has so many good properties for people. This is just part of the culture, though. It's not because you're told to by a doctor necessarily that it's something that you should consume daily.
Unfortunately, I feel like Wild Turkey is kind of built on the foundation of like faith. A lot, like the Turkish Medical Association, for example, in this article, Turkey legalizes alternative medicine, rejecting the alternatives to medicine and treatments that are not scientifically proven. So you can see that there is sort of a pushback between the medical community and alternative healing.
The issue is that the scientific method can't actually prove some of the things that work for the public. Like, how do you measure someone's well-being, right? If someone's quality of life is good and they're living their life through these practices as their parents have and their parents have and so forth, then, what really can a doctor in uniform say to dispute that? Who better to judge my well-being than myself, I guess is the attitude.
Yeah, that is a great point. I think within Western medicine, we put a lot of faith into these people in lab coats, right?
Yeah.
We give them the authority to kind of probe and prod at our bodies.
Yeah.
For them to determine, in their best judgment, what is right for me, personally. And, oftentimes they do get it wrong. Like, they don't actually know what's best for you.
Because oftentimes one looks at the symptoms and not the person behind it. And when you have that mix, everyone's case is different.
Yeah. I think there also is a detachment between the person itself and the symptoms that they're experiencing, for sure. That's very true. Yeah, it's funny because also in Western medicine, that the only reason I feel that alternative medicine is even getting a say now is based truly on the consumer. You know, it's become marketable. It's become something that they can profit off of. Yeah, and even in the article, Integrative Medicine in the Hospital, Secular or Religious, they talk about how they are changing the terms and the labels that they're using to make it seem a little bit more catering to the Western view, like under the Western medicalization view. I just feel like also we're missing like a kind of like a cultural and historical context there too. I feel like not a lot of people are aware of, like, you know, the historical context of like Reiki. Right. And we're kind of taking it as it's being provided. Also, I found another article that was talking about how Turkish people are more inclined to seek out complementary alternative medicine. Whereas I feel Canadians actually are kind of only warming up to the idea that alternative care, due to the relabeling of complementary alternative medicine, is being...
I would say there's definitely like extremes on both sides. Like here you would go to your doctor, but in Turkey there is this kind of epidemic where people will go to their local mosque before they go to their hospital to see what you know the elders have to say about their situation. And truthfully, sometimes you really just do need some Prozac. But you're not going, that's not what you're going to be told at your mosque. Instead, you're going to be told to probably like get closer to God through practice, right? So it's interesting because, again, like they're both healthy in doses. I think the sweet spot is being able to harness both sides of like professional medicine, and I guess you could call it like holistic medicine, for like the best health outcome. Yeah,
definitely. That's why I believe that integration between the two sectors, like the professional and the alternative sector, is kind of like the ultimate sweet spot. I mean, you kind of get the best of both worlds, where, say, you can go to therapy and your therapist can try like specific meditational routines along with like your CBT or your DBT. Along with your antidepressants, you know? Like, you have these other methods to try out, and I don't feel like we should be limited to specifically Western, the biomedical model.
It's true,
well, thank you, everybody, for listening. This has been a great conversation. Thank you, Hande, for joining me on this podcast.
It's a pleasure.
Thank you.
Thank you.
Goodbye.
Bye, everyone.